I am Dr. Suraj Chirania, hematologist and BMT physician. Welcome to our channel. Today we will discuss how we diagnose blood cancer, how we do the screening of blood cancer. Friends, the blood test most commonly done by any hematologist is complete blood count. In complete blood count, usually hemoglobin, WBC and platelets are measured. In WBC, the main cells are neutrophils, lymphocytes, monocytes, and eosinophils that we commonly seen in our complete blood count report. But in case of blood cancer, along with these four common cells, there can be atypical cells like blast, means premature cancerous cells happen inside the blood, so that they can be easily detected by doing a complete blood count. This is a ominous sign. What it does, it alters the neutrophil lymphocyte ratio. Usually neutrophils are twice as much as lymphocyte. Usually neutrophil percentage is 40 to 80%, lymphocyte percentage is 20 to 40%. In most of the blood cancer, this ratio is reverse. Sometimes in cancerous condition like acute myeloid leukemia, monocytes are increased, which on checking on the peripheral smear, we diagnose them as acute myeloid leukemia. Then second most common things test required is a renal function and liver function test, because most of time these tumor cells die fast. Most of the patients, the place of destruction is either liver or spleen, so that their dysfunction can also happen. Third test is a LDH, lactate dehydrogenase, because the cancerous cells activity of the cells increase, leading to a rapid turnover. This will indirectly leads to the increase in the LDH. After detection of abnormal cells in complete blood count, we may need to do a bone marrow test. This is the fourth most common test. In that bone marrow test, we under the provision of the local anesthesia, we anesthetize the right or left posterior superior iliac spine. After giving local anesthesia, we insert a bone marrow needle and take out the liquid part such as bone marrow, and the solid part means bone marrow biopsy. Both are required for a diagnosis of the blood cancers. After this doing bone marrow aspirate biopsy, sixth most common test is karyotyping and fluorescent in situ hybridization. These tests are required in most of the leukemias and myelomas patient. It will tell there any chromosomal defect inside our body. In our body, generally 23 pairs of the chromosomes are there. So there can be defect in either of the chromosomes, leading to shortening, lengthening, or translocation of these chromosomes that can be easily picked up on the karyotyping. Sometimes these changes are too small, so we use special probes called as fish probes, just like translocation 922 in case of CML, that can be easily identified by doing this test. Seventh most common test is a molecular test like next genome sequencing, where we will figure it out which is the gene if defected in the blood cancer. So in many problems like acute myeloid leukemia, myelodysplastic syndrome, and myeloproliferative neoplasm, these genes are affected. So this can be easily diagnosed by doing the next genome sequencing that usually we carry out on the peripheral blood. Coming to a next topic, it's screening for blood cancer. Sadly, there is no such screening test available for detection of the blood cancer at early stage. Most of the acute leukemias happens very rapidly in a span of 1 to 2 months. They don't give time to do screening. Sometimes diseases like chronic lymphocytic leukemia and chronic myeloid leukemia can be identified when we do our CBC on the routine yearly checkups, or due to some symptoms like weakness, fatigue, or fever. So otherwise there is no specific screening test for diagnosing blood cancer. So today we will end our this topic of discussion. Until next, stay tuned, stay healthy, and stay informed. Thank you.